Can we detect diabetes even before the blood sugars actually go up? There are some tests now available. One is called a glycosylated hemoglobin. It's a 3-month average of your blood sugar. This is a nice, useful indicator of mild or future risk of diabetes, and it should be done regularly. It's an ideal test to look at prevention of damage to various organs in the body. Next slide, please. Stress. We all know about it. We've all faced it in day-to-day life. Your children would be facing it every day, especially those living abroad. They live in the very stressful conditions. Students studying abroad, people working abroad. Life is full of stress. But we need to keep an eye on stress levels and make sure that we can control them. Next slide. It could be mental stress, it could be physical stress. Physical stress, inadequate exercise, at the same time damage to the body because of abnormal postures, abnormal stresses to the body, repetitive stress injury, especially in the computer era. This is becoming a very common problem. All this adds to the overall stress to the body. Next slide. Factors such as food habits are playing a very, very important role today. Most of us have an unbalanced diet, have a fondness for fast foods. Almost all of us eat food at the wrong time of the day. There are long gaps between meals and large meals taken at wrong times. All these eventually injure the body. Next slide. Smoking. I'm sure all of you know a lot about the harms of smoking. Remember that even passive smoking is as bad as active smoking. So if someone in the house is smoking, the other members in the house are going to suffer equally. Someone in the office is smoking, the people around him are also going to suffer. So you should resist all forms of smoking. Next slide, please. High blood pressure, unfortunately, detected late, treated inadequately, not only in this country, worldwide. We still don't know what is the best level to bring your blood pressure down to. Studies are still coming every day with newer and newer data. Blood pressure is a result, again, of stress, sedentary lifestyle, too much salt in the food, obesity, certain hormonal disorders. If your kidney is weak or damaged, you can have high blood pressure. And if there is a familial tendency for blood pressure, then you are at risk of developing high blood pressure. Next slide. Some people have symptoms, most don't have any symptoms. You can detect it only by measuring the blood pressure regularly. But some people come with headaches, fatigue, irritability. The advice today is to have regular blood pressure checks from an early age itself. We are now seeing high blood pressure even in children. So please remember, part of it may be the very severe peer pressure on children to achieve more. 10 standard children, 12 standard children are coming with high blood pressure. Next slide, please. What is normal blood pressure? As I said, 10, 15 years ago, we said 140 by 90. Then we said 130, 80. Now we are saying 115 by 75 should be the target. So blood pressure, we still haven't understood well, but lower the better in most situations. Remember that every 10 millimeter rise in blood pressure leads to a double risk of heart attacks and strokes. Next slide. So high blood pressure, big risk for various diseases, heart diseases, strokes, kidney, eye damage. Next slide, please. High cholesterol, again, very important problem. Familial tendencies are there. Certain families have a tendency to have high abnormal cholesterols. Mainly bad diets, lack of exercise. Diabetics tend to develop high cholesterol levels. Abnormal mean timings. Some people with thyroid disease can have high cholesterols. Next slide, please. There are two types of cholesterol, good cholesterol, bad cholesterol. So it's not only enough to have low levels of bad cholesterol, it is equally important to have high levels of good cholesterol in order to have protection to the body. So the blood vessels get injured if the balance between the good and the bad cholesterol is wrong. So that ratio needs to be maintained. Next slide, please. Obesity, again, a big problem. Simple way to calculate your body mass index. It's available on the Arogya Darpan site. Go and have a look at it. And if you're way above your body mass index, you must pay attention to your weight. Next slide. Can be, as I said, detected by calculating your body mass index.